Hey there, everybody, and welcome to our advisor training here at Senior Benefit Solution, short version YSBS. So excited to have you today and to go through the onboarding so that we can get you all set up and get you trained so that you're able to help all these 10,000 people that turn 65 every day, plus anyone else that is 65 years and older or eligible for Medicare. All right. Bear with me, guys. It's allergy season, so I have a little bit of allergy stuff going on. So that's why you hear my stuffy nose. But I'm excited to be here. I'm not sick. It's just every year pollen are getting the best of me. That's why I like to be out of the country between March and May. But we will get through this together. Okay. If you have any questions, guys, just for housekeeping rules, please be so kind and write them down, even put them in the chat and save them for yourself so that we can at a later point go over those questions. I'll be happy to answer them at any given time, just not throughout the presentation, okay? And then if you have any immediate needs, always feel free to email or text me, depending on what the situation is, and I'll be happy to answer any questions, all right? So let's get started, guys. All righty. If the computer will work with us, then we will get started. So just bear with me here. All righty. So the agenda for today, guys, is, again, we're going to welcome you to your senior benefit solution. We're going to go and cover some of the Medicare basics today. We're going to talk about the important tools that we use, what carriers we represent and have access to, how an application works, how to conduct a health risk assessment, certain objections and rebuttals that we'll be facing on a daily basis, which you'll get used to. And then we'll also talk a little bit about leads, okay? Now, just a little bit about myself. I am Kevin. If you haven't gotten to meet me, I was born and raised in Germany, actually. I moved to the States about 10 years ago in 2013, so almost 10 years. I am a former hotel general manager for Hilton Hotels. I was in the industry for about 10 years. Did an apprenticeship in Germany, worked there for a good 4 years, and then came to the States, worked my way up in hotel management, worked in each department. And I did graduate with a bachelor's degree in business administration from Georgia State University. And I've been now about 4 years in the industry, okay? I love to travel. If you follow me on social media, I will always see I'll post some sort of inspirational photos, videos, reels, you name it. Feel free to hashtag, comment, like, and share, right? And if you have any questions regarding travel, I'm always here to answer any questions for you. Flight hacks, how to get discounts on hotels, how to get free breakfast and amenities and things of that nature. It's my passion, all right? But besides that, I love being in the insurance industry because each and every day we make a difference in serving communities. We're able to educate them, not to mention we're able to make some money while we're educating them, okay? Now, who do we partner with? The company that we are actually contracted through is called Innovative Financial Group, okay? And I'm so grateful that we're partnered with Innovative Financial Group because they're truly an umbrella company that offer any given product. And they allow us to be very flexible as it pertains to how we want to do business, as long as we do it by the book. And so they are based out of North Carolina, Wilmington to be exact. They've been around since 2014. It's called an IMO because it's an independent marketing organization. So anytime you want to contract with insurance companies with multiple, you have to go very likely through an independent marketing organization. And that is the big umbrella company because a lot of insurance companies do not want to give or deal with agents directly, right? And so therefore they have us deal with them. And then the contracting department, in this case, at Innovative Financial Group, submits all of our contracts and manage and facilitates those. Now, Innovative and Friends has grown over 10,000 agents in a short period of time. We are one of the largest IMOs that writes Medicare, and we have some phenomenal people at Innovative Financial Group, guys. I'm so grateful to be partnered with them, and yeah, I've been before with a couple of other IMOs, and I wasn't as happy, hence me finding Innovative Financial Group about 3 years ago. And so they do give us access to anything that we need. All right. Now, what system do we use, guys? There's a couple of things that is really important for you to have success, and we'll talk a little bit later about that as well. But the number one things is if you don't have people to talk to, right? Clients, leads, prospects, right? In this case, it will be leads in hopes that you can turn that lead, which is somebody that requested information, that you turn into a potential client, okay? We will look at our inbound versus outbound, receiving calls versus making calls to prospects that have requested information. It is very rare that you will ever call randomly a list unless you choose to, but you have to be careful with litigation issues and TCPA compliance and things of that nature. So we want to make sure that we utilize leads that are actually qualified leads that have requested the information. All right. We'll talk a little bit about preset appointments. So we do offer preset appointments. We have a virtual assistant team that sets appointments for us, meaning the lead comes in, the leads get sent to the virtual assistant, and the virtual assistant sets appointments, and they can be put right on your calendar. And then therefore, you will get those appointments once you open your calendar and simply call those clients at that time. Okay. We do a little bit of both. We call a lot ourselves, but we also have the assistant of preset appointments. And depending on if you're an hourly employee, if you are a broker, which is an independent agent, you have access to that. That might be a fee, that might not be a fee. Just discuss it with me and I'll let you know. Okay. Now, as it pertains to the state-of-the-art CRM, so basically we have a CRM called Go High Level. It is really a lead aggregation system, but many of us in the insurance industry do use it as a CRM. So we utilize it to make calls. We utilize it for text messaging. We utilize it for emailing. We utilize it for reminders and things of that nature. Okay. And we also utilize another system called Sunfire. Sunfire is basically the system that we use to quote and enroll most of our clients. There's a couple of other sites, but it allows you to compare based on the client's zip code, medications, and things of that nature. It allows you to basically do some comparison and then make the decision, or at least advise the client on what's available in the area. CSG would be for our Medicare supplement products. And then we do use Medicare.gov in case the client has a lot of medications or Sunfire is not working. So Medicare.gov has an option for you. It's pretty much very similar to actually Sunfire, and it does allow you to look up plans in clients or prospects areas. Okay. And then we have our support system, right, which is myself and many others across the board of IFG that will help you with any questions that you might have, along with the carriers have their agent support system as well. Awesome. Now, you might wonder what are some of the advantages to being in telesales versus being out in the field, meaning going from one client to the other, right? And so some of the advantages that I greatly appreciate, because some of you might know I used to be in the field going from one house to the next. I used to start door knocking when I did life insurance and then Medicare, and then I switched over to the phone, and I'm so grateful that I made that decision. You're able to work from the comfort of your home, right? You don't have to wear, you don't have to dress up or anything of that nature. You don't have to worry if it's raining, if the sun is shining. I used to get beat up from the rain. I get beat up from the sun. Had my cooler in the car, ate lunch in the car, and now I can go to the refrigerator, heat up a nice meal that I maybe already prepared or things of that nature, right? You're able to assist beneficiaries that do not want to meet in person. There's always those, as you can imagine. And then also you're able to assist beneficiaries all over the United States, okay? And then if somebody is, let's say, for instance, you do have an appointment set with someone and they do not show up, you do have the ability to actually just move on and call the next one. Whereas if you're in person and you've driven to an appointment, next thing you know, they don't show up, then now you have to drive 30 minutes to get to the next person. All right. Now, I want you to take a deep breath, guys. I know it's a lot of information, but it's very vital that you do take notes. And again, you will have access to these slideshows later as well. So don't worry, you don't have to write down everything or take screenshots. You'll literally get the presentations. But what I do want to make sure is that you gain understanding and then you gain knowledge from what we're discussing today. Okay. So the next thing that I want us to do is basically break down Medicare 101. How does Medicare work? And then in the presentation slides to come, you'll see a little bit more details as it pertains to the different parts, etc. All righty. So what is Medicare? If you don't already know, it's a health insurance program for people that are A, 65 years and older, B, people under the age of 65 can still qualify if they've been fully disabled for 2 years or longer. And then also people that have end-stage renal disease. So anybody with kidney failure or mainly on dialysis, that's really what it is. They automatically qualify for Medicare. Okay. Who are plans administered by? All plans, as far as Medicare Advantage plans, are administered by CMS, standing for Centers for Medicare and Medicaid Services. Okay. And then who controls enrollment? So anytime that you do submit an enrollment application, it goes through the insurance company, but the final decision is always made by CMS. Okay, so enrollment is done by Social Security Administration, or if you were working for the railroad, then it would be the Railroad Retirement Board. All right. Now you might wonder, how do I apply for Medicare? Okay. You don't have to be retired to apply. I have quite a few clients that are still working. Even one of my former housekeeping supervisors, she used to manage the housekeeping department for me. She just turned 65. She's still working in the hotel industry, meaning I actually enrolled her into Medicare. I helped her apply online. And so you can still continue working. You can either contact the Social Security Administration by calling them. I will tell you, it'll take a good minute to get somebody on the line because everybody's calling, right? You can assist individuals by going online or having their family members, or if they're tech savvy enough, they can do it themselves by going to www.ssa.gov. I have the hyperlink here. You're always welcome to send it to the client. And there's also, we have a document that has all links included. So you can just send that to that client. All right. And then lastly, mailing in the application. The post office has been running behind since some of the circumstances that happen in our world. And I would just not recommend paper because it can get lost easily. So my personal recommendation is that you advise your clients to go online and fill it out. If they're not able to, then have somebody assist them, if not us. Okay. Now, if you're already receiving Social Security benefits, guys, or if the client is already receiving retirement and railroad retirement benefits, they will automatically be enrolled into their plan. Okay. And when I say their plan, I mean into Medicare, not a Medicare Advantage plan, just original Medicare Part A and B. Okay. Part A, pardon me. Part B, they still have to go online. I will take that back. If somebody is already receiving a Social Security check, or if they're already receiving railroad retirement benefits, they will automatically be enrolled into Part B. Okay, so we'll start, and I will go over that in just a second, automatically. So you do not have to worry about it. All right. Now, as far as the basics go of Medicare, okay, there's 4 main parts to it, guys. As you can see here on the screen, there's Part A, which is your hospital insurance. There's Part B, which is your medical insurance. We have Part C, which is considered a Medicare Advantage plan that then includes Part A and Part B. And then we have Part D, which is a prescription drug plan. Okay. Now, I'm going to break down a little bit of what it entails to have those different parts. Okay. So just to kind of start off with Part A. Part A really covers your hospital care, as I mentioned. So things such as inpatient hospital care, if you have to go into a skilled nursing facility, if you need home health care, or even if hospice care ever will be the case for you. Okay. Now, as far as Part B is mainly for your doctor visits, so such as doctor services, for checkups, outpatient surgeries, if you need preventative surgeries, if you need an x-ray done, like a diagnostic test, some sort of therapies, as well as durable medical equipment like a COPD machine, CPAP machine, etc. That will fall under Part B. Okay. And then Part C, as I mentioned, is the Medicare Advantage plan. That will automatically replace what you see on the left side, Part A and Part B. That's all original Medicare is. So if you sign up for a Medicare Advantage plan, that will replace the original Medicare. And it offers at least the same as original Medicare. So what you see on the left-hand side, it covers at least that at 80%, or it adds on additional benefits, okay? And if you see TV commercials, I don't know if you watch TV, I don't, but I hear it all the time from my clients and prospects. They tell me, oh yeah, I see it on TV all the time. They get dental, vision, hearing, over-the-counter benefits, food card, flex card, and there's things of that nature, right? So certain plans include certain things, and we'll look into details as we go through the training here. And then also, some Medicare Advantage plans do include drug coverage and some do not. So we'll talk about that a little bit further. But a Medicare Advantage plan oftentimes does include a prescription drug plan. All right. And then the last part is Part D for drugs. And that would be basically outpatient prescription drug plans. Okay. Again, if you have any questions, we can certainly go over that at a later time. Just take note of it right now, and you have access to all these slideshows as well as to rewatch these videos as well. Okay. Now, most people do receive their Part A premium at no cost to them. Okay. What the requirement is that you worked at least 10 years, that you paid into the tax system for at least 10 years. Really, that's the terminology. You can still get Part A if you did not work 10 years, okay? There will be a monthly premium payment, and as of right now, that premium payment is about $400 and some. I think it's at $455. I was just talking to Medicare the other day, and he quoted me around $455, okay? If you do not qualify for it, there's still a couple of ways that you can be eligible for assistance programs. So not everyone has to pay the $455, but we don't make that decision. If somebody wants to see if they qualify, they can either call Social Security, which I put down the phone number. And then if somebody is on Medicaid, so not Medicare, Medicaid, which I will explain a little bit later, more in detail, there is also a way to get assistance through Medicaid to see if they can pay for that $455. All right. Now, how does enrollment into Part B work and how much does it cost, right? So there's also ads out there that your clients will get in the mail, or your prospects that they fill out. Hey, get back the $170.10 for your Part B premium on your Social Security check, okay? In 2022, guys, the Part B monthly, it is monthly, premium payment to be and have Part B to see your doctors or anything of that nature, as you guys can see here on the right hand side, is $170.10. Last year, or in 2021, it was $148, and the year before in 2020 it was $144. Okay, in some sense. Now, the initial enrollment period, you will hear often the terminology IEP. It's a 7-month cycle, guys. It starts 3 months before the month of your birthday, okay? The month of your birthday and 3 months after your birthday month, okay? So if your birthday is in January, and that is your birthday month, you can enroll October, November, December is 3 months before, January, February, March, April, okay? That is 7 months. 3 months before, the month of, 3 months after. If somebody fails to enroll and doesn't have any specific requirements or reasons why, and we'll look at that as well, what is a reason for you not to get penalized? You can then get a late enrollment penalty, okay? We'll talk about that. There's also what we call the GEP, which is the general enrollment period. every single year between January 1st and March 31st, clients are able to enroll. So let's say, for instance, I did fail to enroll into my Part B, okay? And I now want to enroll. You can only enroll if I fail to enroll this year. Let's say it's June right now, okay? And I failed to enroll because my birthday was in January and it's June. I will have to wait until we come back to the general enrollment period between January and March. And then the Part B for that client is not going to go into effect until July. So July 1st would be the Part B effective date, and the Part A effective date was in the past, January 1st of this year. Okay. Now, usually the premium penalty is about 10% for each 12-month period that you were eligible, but you failed to enroll. And so you do have to pay that penalty every year, basically every month, okay, for as long as you do have Part B active, okay? There is a few exceptions where you don't have to pay it, etc. If you have creditable coverage in place, and we'll talk about that in just a second. Now, enrolling into Medicare Part B continued. How can I delay my enrollment without being penalized? Okay. Now, if you're currently covered under an employer or a union health plan, okay, now that employer has to have at least 20 employees. If you have less than 20 employees, then it does not count. Okay. But based on your current employment, you can also, if you have coverage through your spouse, for instance, let's say your spouse is still working and you are insured through your spouse, and then you have basically credible coverage with that. If you are covered under like a union or anything of that nature, those are all reasons why you would not be penalized or for you to be excused to be penalized, okay? Now, you will get a special enrollment period if, for instance, your spouse's group insurance stops or you get dropped for whatever reason. You have 8 months, guys, to actually make then an enrollment selection, okay, from the date. And you just need that document stating that you have been dropped for whatever reason, okay? Or you need documentation showing that you had creditable employer coverage through your employer or union group health plan. All right. I hope this makes sense. I'll be happy to further elaborate. I don't want to overwhelm you guys. All right. Now, how do I pay? What are my options to pay the Part B premium? Right. So the ways to make the monthly premium payment, you can either have them take it out of your Social Security check. And remember, if you're already enrolled into Part B before you actually, or if you're already receiving a Social Security check before you get on Medicare Part B, it'll automatically be deducted from your Social Security check unless you make any changes. If you're new to Part B and you haven't been receiving a Social Security check, you have to make a selection, okay? You can go online and have them take it out of your Social Security check. If you had the railroad retirement benefits, you can have them take it out there. Federal government retirement, you can set up an automated bank draft on Medicare.gov, or they also have an option called Easy Pay as well on Medicare.gov, where you can have them take it out from there. All right. Now, if they want any specific information to your clients, it's best to call Social Security Administrations, or if they did work with the Railroad Retirement Benefits Office, they can call them. Okay. If you do not make a selection, guys, you will get a bill in the mail every 3 months, 170 10 times 3. So it's around $570 or something like that. And you have to pay it. If you fail to pay it, you will be dropped from Part B. If you enrolled your client into a Medicare Advantage plan, that will automatically be dropped. Just happened for the first time to me. One of my clients failed to make that first payment. Again, there's a couple of ways to get them back on the books and to help them make the payment and set it up, but we'll talk about that at a later time. All right, what are your choices? Okay, this is really important that you understand this, guys. We have 4 choices as individuals that are aging into Medicare. You can either stay on original Medicare, which is just A and B. You can have Part C, which is a Medicare Advantage plan. You can be on another Medicare plan. So some people have, for instance, they have a plan through their former employer. Sometimes it's a supplement plan, right? Which is also called a Medigap plan or a Medicare supplement plan. And then last but not least, you can have a Medicare prescription drug plan. Okay. And just to point out here, guys, anytime you have the first option, which is a Medicare Advantage plan, which I'm sorry, if you have an original Medicare plan, you have to have a prescription drug plan. If you do not have a Medicare prescription drug plan, you will get penalized for not having a drug plan. So whenever you do then eventually move on to, let's say you have for 2 years just original Medicare, and you then eventually want to enroll into a Medicare Advantage plan that does include drugs, they will send you a letter with your penalty for all the time that you didn't sign up for a prescription drug plan. So what I'm saying is, even if your client tells you they don't take any medications right now, find them and see if there's a $0 monthly premium plan available for prescription drugs and have them get on it. Even if there's a $5 plan available, I'd rather have them pay the $5 than to be penalized, because eventually we all have to take some sort of medication. All right. If you have any questions, let me know later. All righty. Now, what does original Medicare cover? All right. So you can go to any healthcare provider that accepts Medicare, which is most doctor offices. You will be responsible for the Part A deductible, which in 2022 is $1,556. Okay. And that's for hospital stays up to 60 days. Now, there might be an additional cost after 60 days. It all depends. All right. And then there is a different cost for other Part A services. All right. Now, the skilled nursing facility care service, there is a qualifying stay required. Okay. Usually day 1 through day 20 is $0. But then from day 21 till day 100, it can be $194.50. Okay. As it pertains to the Part B, guys, for Part B, there's an annual deductible of $233 in 2022. In 2021, it was $198. So it does go up every year, like everything else, the loaf of bread, gas, and you name it, right? And what's really important, you do have a 20% co-insurance on most Part B services. What that means is, if I go to the doctor and I do an outpatient hernia surgery, okay, the bill is $1,000. Original Medicare will cover 80%. You will be responsible for 20%. Okay. So it's really important that we understand Medicare. If you're on an original Medicare or Medicare Advantage plan, most services are only covered at 80%. Okay. Now, as you guys can see a little hint down there, there's some programs that actually help with that, and we'll go over that at a later time. But I want you to be aware of this. All right. Now, a few years ago, the Medicare ID card looked a little bit different, and not as it pertains to the red, white, and blue or anything of that nature, but it used to have your social on it. Okay. So nowadays it has a random alphabetic numeric correct characters. So it's 11-digit and number combination right here. Okay. So it's really important when you speak to a potential client and they give you that information, that you actually read that out loud. Ms. Jones, what I need you to do is give me your Medicare ID number. All right. So go ahead and grab your pocketbook or wherever you have that located. I'll wait right here, and I'll get the system pulled up to put that in. All right. Wonderful. All right. And then once you have it, you put that in. Okay. So in this case, you just want to advise them, if they still have the old one, we can help them look up their new Medicare ID number. And they did that for security reasons, because if you would lose your Medicare ID card and your social is on there, there's fraud going all day long everywhere, right? It's going crazy. So make sure that you advise your client to reach out to Medicare to request a new card, or you could even assist them with that, and I can show you how to do it. All right. Now, we did talk a little bit about Medicare supplement plans, but let's take a further look into those. Medicare supplement plans are basically health insurance policies which are sold through private insurance companies, okay? Humana, United Healthcare, Aetna, Anthem, you name it. A lot of insurance companies sell their Medicare supplement plans, okay? Now, anytime that you purchase a Medicare supplement policy, it must say Medicare supplement insurance. And basically, the intent for a Medicare supplement or Medigap plan is to cover the gap that original Medicare doesn't pay. So we just looked over deductibles, co-insurance, co-payments, and things of that nature. So basically, that would be included in some of the Medicare supplement plans. There is some where you have a co-payment, and I'll elaborate a little bit more in detail about that later, okay? Now, you cannot have a Medicare supplement and a Medicare Advantage plan at the same time. You cannot double dip. You can have either one or the other, okay? So as you can see right here, it says does not work with a Medicare Advantage plan. So you can't have that and that, all right? Now, don't get too focused on how many different types are available, okay? There will be a few in detail that we will look at that we work with mainly that are the most popular ones these days, okay? And then there is a couple of states such as Massachusetts, Minnesota, and Wisconsin where they do not have all these plans available, okay? All right. Now, how does a Medigap work? So you can purchase a Medigap usually 6 months prior to you turning 65, whereas the Medicare Advantage plan is 3 months. You can start, you won't get your Medicare ID number until about 3 months before if you apply for it. However, you can use your social with some carriers to put in the application. They hold it, and then once 3 months before comes in, before you're turning 65 and you get that Medicare ID number, excuse me, you can then actually submit the entire application. The benefit of that is basically to lock in the price and for you to lock in that client. But we recommend that you do it 3 months before, just because then you have the information, the client is closer to turning 65. You do have to be 65 years or older, unless again, you did qualify due to being fully disabled or having going to dialysis. And then if you lose certain kinds of health coverage, for instance, you can also buy a Medicare supplement plan as long as it's through no fault of your own. If you drop it because you no longer want it, then you don't qualify for it, okay? Now, if you leave a Medicare Advantage plan under certain circumstances, you can apply and buy a Medicare supplement plan, okay? And whenever the company will sell them one, then clearly you'll be able to. But most importantly, guys, that I want you to know, the difference between a Medicare Advantage plan, original Medicare, and a Medigap or Medicare supplement plan is that there is a monthly premium payment for it. Okay, so it's not free. There's a cost. Depending on the state that you reside in, for example, in Georgia, they start off at about $80, versus in Florida, they start off at about $200 a month. Okay, so that does vary. If you have budget conscious clients that are on a fixed income, a lot of them cannot afford a Medicare supplement plan. So it's kind of a little bit of a different clientele, okay? But that's why we have access to everything, because we do whatever our client needs, right? And that's the beautiful thing about working with a company like ours. We have access to all of them. Whereas if you work with United Healthcare directly, for instance, you can only sell one product with them very often. You wouldn't handle, you would transfer that call. You would not get credit for the enrollment. And one thing I learned within about the first 6 months of being in the insurance industry in general, I was only able to sell one product with the first company I was with. Your hands are really tied and you're not able to truly serve your customer based on their needs and wants, right? Awesome. All right. Now, Medigap policies are standardized. What that means is every Medigap policy must follow federal and state laws designed to protect you, and they must be clearly identified as Medicare supplement insurance policies. Insurance companies can sell you only a standardized policy identified in the most states by the letter A through D, F through G, and K through N. All policies offer the same basic benefits, but some offer additional benefits, so you can choose which one meets your needs, Okay. And then as I mentioned, in these other states, there is a different way of doing it. So the way you kind of want to think about this is no matter if I get a Medicare supplement policy through Humana or United Healthcare within a category, right? A plan G, a plan F, a plan N, as long as I stay within the letter, they offer the same benefit. The only thing that differs is the price. Okay, whereas Medicare Advantage plans is the other way around. It's basically they don't cost, okay, but they all offer different they all have different benefits. Awesome. Now, just a couple of updates between last or 2021 and 2022. Since January 1st of 2020, Medicare plans sold to first-time eligible Medicare members, right, will not be able to be covered for the Part B deductible, okay, which the deductible we looked at earlier is the $233 in 2022. In 2023 and following years, it'll be more, okay? Now, because of this, Plan C and F and high deductible Plan F will no longer be available to people that are first eligible to Medicare starting January 2020. So what that means is if you already had one, okay, if you're already on a Medicare supplement Plan F or Plan G, and you've turned 65 before January 1st, 2020, and health-wise, you can undergo underwriting and you qualify and they approve you, you're still eligible for it. But if you just turned 65 as of January 1st, 2020 or onwards, you're no longer eligible for Plan C, Plan F, or a high deductible Plan F, okay? So that's really that. Here's just a little bit of a chart that will show you the different plans and what they offer. Please don't get confused. I just put this in here for reference in case you want to go back and take a look at it. But trust and believe you do not need to know all these things. And again, I'm showing you here on the next page what are the most popular ones anyway. Okay. There's two plans that are very popular, not by myself, by the industry and by our clients. Okay, so statistically, it kind of has been proven that those two plans are the most popular ones. I will start off on the left-hand side with the Plan G, which is the most popular one currently. It kind of replaced the Plan F, which used to be what they call the Cadillac plan, because it included everything. Okay, because it's no longer available for individuals that are new to Medicare. So the Plan G is now the most popular one. And so what the Plan G includes, guys, it's identical to Plan F, except it does not cover the Part B premium, okay, which is every month the client would pay their monthly premium for the Plan G, okay, plus they would pay their $170.10, okay. The difference in premium from Plan F is often more than enough to cover that Part B deductible, okay? And I apologize here, the Part B deductible is the $233. I'll fix that later. And then open enrollment and underwriting only. So what that means is you can enroll into a Plan G doing open enrollment, okay? AEP, OEP, for instance, or if you're going through underwriting, meaning all Medicare supplement plans have to be underwritten, okay? And what that means is you have to answer certain health questions. They look at your medications and then they determine if they want to insure you, okay? And then there's no guarantee issue Plan Gs, all right? Now, as it pertains to the Plan N does not cover the Part B premium as well, okay? So it's the $170.10. You do pay the annual deductible of the $233, okay? The primary care specialist the primary care physician as well as the specialist copay will be up to $20. So $20 max, okay, per visit. And then the emergency room visit will be no more than $50. If you do immediately get admitted into the emergency room, guys, the client will get reimbursed the $50. Okay. So as you guys can see, there is no copay here. there is a copay here, $20 for up to $20 for the primary or specialist, and then up to $50 for the emergency room. But if you get admitted, you will get the $50 back. There is 20% of excesses charges. Now that happens to maybe like 3 people out of 100. And then about the plan is about $20 to $40 a month less expensive than this one. So when would you suggest which one? If you're talking to somebody that's interested in a Medicare supplement plan, my personal recommendation is if somebody's pretty healthy and doesn't go to the doctor but once or twice a year for a checkup, I would recommend them to save about $20 to $40 a month and go with a plan N that is less expensive, right? And then pay that copay when they do go. Or if somebody does go to the doctor quite frequent, you definitely want to go to plan G route because there is no doctor copayment, specialist copay, etc. Okay. Now, we also have access to what's called ancillary products. So DVH, for instance, stands for dental, vision, hearing. Okay. We use Heartland, Aetna, Cigna, and there's a few other companies. And then also there's products like cancer, long-term care rider, etc. We'll look into those at a different time because I know Medicare is overwhelming. So we can look at this at a later time. Okay. All right. And then Medicare Advantage plans is the other option, as we already discussed. There's a few different options, guys. There's HMOs, which are health maintenance organization plans. Some have what they call a point of service option. Okay, so you'll see POS, it'll say HMO-POS. There is a PPO plan, which is a preferred provider organization plan. Then you have a private fee for service plan, which is a PFFS. And then you have special need plans, and we will look into the special need plans a little bit more in detail. The main difference that you want to know is our HMOs and PPOs, okay? And we will break down a little bit more in detail what the difference is here. My apologies. What the difference is between those, but just to kind of share with you in a nutshell, my allergies. In a nutshell, HMO plans are more benefit rich, okay? However, the way you can think of an HMO network or an organization is if you draw a circle on a piece of paper, the client can only go to see the doctors within that circle. Whereas the PPO is a larger network, the benefits are a little bit less rich. However, you have more flexibility. So anytime you have a client that lives 6 months in Florida and 6 months up north, you want to make sure that you suggest them to go on a PPO plan because they cannot see their doctors down here and up there on an HMO plan. Okay. Awesome. Now, eligibility formal plans. So there's a few requirements that you need to meet in order for you to enroll into a plan. So the first thing is that you live in the plan service area. What that means is zip code and county, okay? All plans are zip code and county specific. If you enroll a client into a plan in a zip code, but the zip code is not affiliated with the correct county, because some zip codes have multiple counties, you can get in trouble or the policy cannot, or the enrollment will be denied by CMS or the carrier because all plans are zip code and county specific. So I just re-enrolled a client, or we disenrolled her from a plan in Georgia. Another agent went out, enrolled the client into a more suitable plan. However, the plan is not even available in the client's county. It's in the county next to the client. And CMS approved it. So I got on the phone with the client as well as we called the carrier, and we were able to file a complaint for wrongful enrollment and misinformation. And the client got re-enrolled into the plan, and I'm back the agent of record, right? Don't miss out on your money, right? And make sure you take care of your clients because we don't want them to get in trouble, right? Now, you have to have Medicare Part A, you have to have Medicare Part B, otherwise you cannot enroll. So if you ever speak with somebody that only has one of the two for whatever reasons, unfortunately, you're not able to enroll them, okay? I had a lady that qualified, she turned 65 in October. She's a life insurance client of mine. And I enrolled her because she told me she has Part A and Part B. She gave me the start dates, okay, and I put it in. And for some reason, the application bounced back. And I was like, what's the reason? I called the carrier and they were like, well, the lady does not have Part A. So I'm helping her now. She has full Medicaid. So I'm helping her now see if she qualifies for Part A. Okay, so that she doesn't have to pay the $450. All righty. Now, you will continue to pay the Part B premium. Okay. You may also pay a monthly premium for the plan. So there is Medicare Advantage plans that even cost. Okay. Most are at $0, meaning at no cost to the member. However, there is plans that do have a monthly premium payment. Okay. Especially if somebody's on the plan from back in the day, it's very likely that they pay a monthly premium payment. Okay. And then if you don't have end-stage renal disease at enrollment, there is some exceptions. And just to let you know, Medicare Advantage plans, it does not matter what health condition you're in. It's only with Medicare Advantage plans, okay? And really, really important, there is certain Medicare supplement plans where you have a guaranteed issue period, meaning no matter what health condition you have with a supplement plan, only within that 12-month period you can actually enroll, okay? All right. Now, how do MA Medicare Advantage plans work? So you usually get all Part A and Part B services through the plan, right? Because it replaces original Medicare. You may have to use the providers in network, okay? Generally must still pay the Part B premium, all right? Unless you have some sort of assistance program like Medicaid. And then some plans may pay all or part of your Part B premium, okay? So there's also plans that are called reimbursement or give back plans, and we'll look at those at a later time. All right. You may get extra benefits such as vision, hearing, dental services, and others, right? Like prescription drug, gym membership. I was talking about a food card, flex card earlier, things of that nature. And then also you must still be in a Medicare program. So meaning, again, you must get all of the Part A and Part B services, and you must have Medicare rights and protections, okay? Now, how do dual special need plans work, all right? And we'll look over that in detail in a slide later on, but dual special needs mean dual, right? So dual means two, okay? One is Medicare, the other one is either Medicaid or you have a chronic condition that the insurance company approves to be a chronic condition that allows you or enables you to be on a plan that covers, okay? Now, a dual special needs plan is for beneficiaries that have Medicare Part A and B and have Medicaid, okay? There's multiple levels of Medicaid. We will get into that later. And then there is a CSNP called CSNP. It's a chronic special needs plan. The beneficiary has to have Medicare Part A and B, as well as a chronic condition such as like diabetes, a heart condition, etc. Okay, each carrier has their own chronic condition requirements, so we'll take a look at that. Now, these plans often offer additional benefits. However, the beneficiary has to qualify, okay? Like the food card, for instance, with most carriers, is only available to individuals that have Medicare and Medicaid or a chronic condition, okay? We'll look at that. All righty. Now, Medicare prescription drug plan coverage is available to anyone that has Medicare, okay? And they're usually provided through Medicare prescription drug plans, Medicare Advantage plan, or Medicare plans. And then some employers or unions, they do offer Medicare prescription drug plans. All righty. If you have questions, write them down, guys. I know this is a lot of information, okay? So this next slide, guys, is talking about basically going over the different enrollment periods for Medicare Advantage or Medicare Advantage prescription drug plans. So as you guys can see, you can be on an MA only, meaning Medicare Advantage without drugs, or MAPD, meaning Medicare Advantage prescription drug plan, okay? Now, there is 3 major enrollment periods. There is the IEP, which is your initial enrollment period. It's a 7-month process, as we talked earlier, 3 months before, the month of your birthday, and then 3 months after your birthday. Okay. You have AEP, which is the largest enrollment period every year, where basically everyone that's already on a plan gets the opportunity to make an enrollment selection for next year. So basically the carriers announce their plans for 2023 this October 15th or prior to October 15th. And then members can enroll October 15th through December 7th. It's a 7-week cycle, okay, which you need to make sure that you're available and work as much as you can, because that is your opportunity to enroll as many people as possible, okay? And that's where individuals are able to make their enrollment selection for the following year, okay? You can join, drop, or switch your coverage, and that coverage will not go in effect until January 1st, the following year, okay? So if I enroll Miss Judy this year, October 15th, November 7th, December 7th, you call it, you name it, anytime between that 7-week cycle, and she does not get enrolled by anyone else after I enroll her, because the last application that that client enrolls into during the 7 weeks is what goes into effect. So it's important that if you have existing clients, that you meet with all of them and prep them right in the beginning of AEP, and then you focus on your new clients that you want to enroll, so that nobody can get your client in a better plan and then it's too late for you to make that enrollment. Because if I enroll Ms. Susie in plan X, Y, and Z, and then Judy enrolls Miss Judy in plan X, Y, and Z as well, that plan, because it's the exact same plan, my plan will stay in effect because I did it first. But if she finds a different plan and convinces the client to go with that one will then go in effect, whichever plan was lost. Okay. And I'd be happy to specify that. If it's the same plan that somebody else will enroll after I did it, it won't go in effect. But if it's a different plan, it will overwrite my plan and it will then go into effect. I hope that makes sense. Okay. And then we have SEPs, which are special enrollment periods or election periods, okay? Such as LIS, stands for low income subsidy. And we'll talk about what that is. If a client moved to a different zip code or county or state, remember, anytime somebody moved, that creates an election period, because you cannot stay in the same plan under Medicare Advantage or Medicare Advantage prescription drug. You have to re-enroll into a new plan because you no longer live in the service area, okay? And then also if you lost or gained status. So for instance, if you have an extra help program, Medicaid, that will give you an eligibility to enroll and use it as a special election period. Okay. So what I'm saying is, guys, if you made an election during open enrollment, and then we know we have OEP, right? January 1st till March 31st. Now it's April. If the client made an election in AEP, the client made an election in OEP, and they're still unhappy, their doctor doesn't take the new plan that they just enrolled in March or whatever the case may be, you do have some opportunities if the client has any of these. For instance, here, LIS, they moved or they lost or gained status with Medicaid, you do have the opportunity to move that client to another plan and use that reason for enrollment. So that's what an election or enrollment period is, okay? You have to have a reason, okay? There's also special election periods currently going on. For instance, if the client didn't get to make an election during AEP or OEP because they were sick in the hospital, you name it, they just didn't get to it, they were overwhelmed and they didn't make an enrollment period, or they were affected by a disaster, for instance, right? Such as like if there was a storm, there was things such as COVID or things of that nature going on. And in this case, they do have, some states and counties have some election periods available for those members, okay? We will do some training on that, so don't be overwhelmed. And I will let you know who has what available, and the carriers will always email us. I got an email this morning, for instance, from a carrier saying in Texas and specific counties, there is an SEP going on. If you didn't make an enrollment, you can now make an enrollment until June the 31st or the end of June, okay? The end of June. All right. Now, late enrollment periods, okay, and how much does it cost? They do charge you for it. They are out to make some money, okay? So basically, people who wait to enroll late, okay? And late means, for instance, after your 7-week cycle, right? There is an additional 1% of the national base premium for every month eligible, but that you failed to enroll, okay? And you must pay that penalty as long as you enrolled into a Medicare drug plan. So I think I touched base on that earlier. If you don't take out a drug plan and you're on original Medicare and you fail to enroll, there's a 1% penalty. We do not know how much that is, okay? That is not our job to find out or to determine. However, they can call Medicare and they will tell them exactly what that is. We don't, they have the calculator, we don't, okay? Now, again, if you have any other coverage in place that's as good as a Medicare drug plan through your former employer, etc., that's considered creditable coverage, then you won't get charged that late enrollment penalty. Okay. Now, what are the enrollment periods for med subs? We talked about it earlier that you can actually enroll up to 6 months before. We recommend that you wait 3 months, but long story short, 6 months before, the month of, and 3 months after. So very similar, okay? You do have 8 months to enroll, as I mentioned earlier, after you lose some sort of employer or group coverage. And then also you can switch anytime during the year with a Medicare supplement plan, okay? And then PDPs, which are the prescription drug plans, you can only change those during AEP, okay? And remember, a lot of people do switch their Medicare sub plan once a year, every other year, as long as they qualify from a health perspective. Reason being, if they can find a cheaper plan, a less expensive plan, or a more affordable plan that suits their budget better and still get exactly the same benefits with a Medicare supplement plan, why not go with X, Y, and Z instead of being with this company? So you have to make sure that you touch base with your clients that are on supplement plans annually, which I recommend you doing with any client, no matter what plan they're on, simply because you want to stay in touch with them and make sure that you're in the best plan possible, okay? And then just remember, when you first turn 65 or you're first eligible for Medicare, you do have a guaranteed issue period, which lasts about 12 months. There's a 12-month trial period, right? So you'll run into a lot of people with a med sub through their employer, and they get told by their employer, if they switch to a Medicare supplement that might be less expensive and more affordable for them through a private insurance company, right? With us, for instance, and they cannot go back. That is not true. You do have a 12-month guaranteed issue period where you can try it out once for 12 months and then go back if you didn't like it or it didn't work as well as your former group employer plan. All right. And then as far as prescription drug plans, at a minimum, they must offer standard benefits, okay? So like in 2022, there might be a monthly premium payments, there might be an annual deductible, which is no more than $480, okay? There can be co-payments as well as co-insurance, and then very little after you're paying $6,350 out of pocket. So if you're taking a lot of medications, just because there is a prescription drug plan that you're on or it's included in your Medicare Advantage plan, does not mean you don't pay anything for your meds, okay? And I'll show you later how it works. It's basically the medications fall within a tier level. So there's multiple tiers, and depending on from the least lowest, most generic medication that costs the least is usually on the lowest tier, and then the more expensive and more specific and brand name the medication is, the higher the tier. And so the insurance companies usually, or the plan itself, covers a certain percentage, and then you pay either don't pay anything or you do pay. So that's also a great way to put in the medications for a client and see if you can find them a plan that covers their medications much better. During AEP last year, I saved a client, I think that was on the supplement plan. I couldn't help them on their supplement plan, but I did enroll them into a prescription drug plan and saved them like $400 a month. That is a lot of money, especially for most people on a very tight budget with everything going up, right? And then It may also offer some sort of supplemental benefits. Plan informations and costs are available on Medicare.gov. Okay. All right. I know it's a lot of information, guys, but we're getting there. Okay. We'll have a few more slides here. Now, Medicare Advantage open enrollment period in 2022. Okay. It usually runs from January 1st till March 31st, and it takes place of the MAPD, which is the Medicare Advantage disenrollment period. Okay. Now, Medicare Advantage Plan open enrollment period applies to beneficiaries who are already enrolled in a Medicare Advantage plan as of January 1st. These enrollees can use January 1st to March 31st MA open enrollment period to enroll into another plan or disenroll from the plan to return back to original Medicare. So anytime you have a client that no longer wants to be on a Medicare Advantage plan, this is their opportunity to actually go back on original Medicare. Okay. If they're new to Medicare and who already enrolled into a Medicare Advantage plan during their AEP, for instance, or IEP, they're able to get an MAOEP starting the first month of entitlement to their Part A and Part B and ending the last day of their third month of entitlement. Okay, so to give you an example, if your client becomes eligible for Medicare in February, okay, and their MAOEP will start February 1st, they actually have until April the 30th, okay, instead of the January till 1st till March 31st, which is only for people that are already on the plan. Okay, I hope that makes sense. All right, cool. Now, what does Medicare Advantage open enrollment mean for you or for your clients, right? So enrollees get a one-time election period to make in any of the following changes through the MA open OEP, right? The open enrollment period. So here's basically a list what they can do, guys. So you can either switch from a Medicare Advantage prescription drug plan, which is an MAPD, to a different MAPD. You can switch from an MAPD to an MA only. You can switch from an MA only to an MAPD. You can switch from an MA only to a different MA only plan. You can drop the MAPD and return to original Medicare with or without a Part D, which is a prescription drug plan. Remember, if you don't have one, you get penalized once you do pick something up. You can drop an MA only coverage and return to original Medicare with or without the Part D. Okay. I know this sounds like a lot. Don't get overwhelmed. We'll get to this. We'll work on this. Okay. But at the end of the day, in the Medicare Advantage or Medicare Advantage prescription drug, you can flip-flop during that time frame during OEP. Okay. However, there are some stipulations for beneficiaries enrolling into original Medicare. If an enrollee has original Medicare, they cannot use the MA OEP to switch to an MA plan. Okay. They can do that during AEP, which is the annual election period, but very likely they cannot use OEP election period to enroll into an MA plan. The only way you could do it is if they have an SEP available, like the disaster, and you say, oh, they forgot to enroll or they were affected by something. Okay, then you can use that code during that time period if it's available to enroll. It's a lot, I understand. I'll get you there. Okay. The MAOEP does not apply to beneficiaries who have a Medicare savings account, also called an MSA, okay, or another type of Medicare health plan, such as Medicare cost plan. Medicare supplements are also exempt as they are connected to original Medicare, which does not apply to the MAOEP, okay? And then enrollees of standalone Part D prescription drug plans, including those who have original Medicare, cannot use the MAOEP to make changes to their coverage, right? Remember, if you want to make changes to your Medicare prescription drug plan, you have to do that to your prescription drug plan. You have to do that during AEP, October 15 till December 7th. All right. What agent marketing activities are forbidden during the MAOEP between January and March? So there's lots of rules and regulations, guys, how we can market and target and prospect clients. During OEP, CMS forbids agents and brokers from intentionally targeting and sending unsolicited marketing materials to Medicare Advantage and Part D enrollees during the Medicare Advantage open enrollment period. Now, during that open enrollment period, brokers and agents cannot engage into activities that use MAOEP as an opportunity for additional sales, okay? You cannot call or contact enrollees who have made a new plan selection during AEP. So you cannot call clients that fell off the books during AEP and say, hey, Ms. Jones, I used to be your agent. You made a different decision. What happened? It's too late. Okay, that's why it's important that you make that during AEP while they're still your client. You cannot purchase lists or identifiable information in attempt to directly target beneficiaries during the MAOEP because they made a selection during AEP. Okay, nor can you send unsolicited marketing materials referencing the MAOEP or the opportunity to make an additional enrollment change. Again, you have access to this. All right. Now, what can you do since we just told what we can't do, right? All righty. Now, what you can do is you're limited, right, in marketing activities during Medicare Advantage OEP. However, you are able to conduct marketing activities that focus on other enrollment opportunities, including but not limited to send out marketing materials that only when a beneficiary makes proactive requests. So if somebody reaches out to you, you are allowed to reach back out to them and educate them and help them in finding a different plan or whatever their needs are. You can set up a one-on-one meeting only at the beneficiary's request. So again, if they reach out, you can. And then you can market 5-star plans by regarding their continuous enrollment SEP. So what that sentence means, guys, is if you find a plan that has a 5-star rating, which there's not a lot, but there's always some available, that will create an SEP for you to enroll a client. So if a client is on a plan that's less than a 5-star rating plan, which a lot of plans are, and you find a plan that suits them better and is more beneficial, and you suggest they enroll into that, if that plan has a 5-star rating, that will create an SEP, okay? Then also you can focus on marketing to people that are aging into Medicare, meaning people that are turning 65 who have not yet made an enrollment decision, okay? So usually once OEP is over, you can help people that are turning 65. You can help people that have LIS, that have Medicaid, that are eligible to get Medicaid. We help them apply for it and show, basically, we guide them through the process. Okay. Now, for more information, as always, we can call Medicare. We can look on Medicare. We can look on CMS website. There's the State Health Insurance Assistance Program site, as well as the Medicare Your Handbook, which is like a big blue book that they get. Okay. Now, this is the end of this slide, guys. There is multiple slides following to this one. If you have any questions, please notate them. We will be going over them now so that you don't get overwhelmed with the next slide. And then if you have any messages that you want to send me privately or any questions, this is really an opportunity for us to interact, because if you now have questions, it's very likely that somebody else might have the same questions. If you're rewatching the video and we're not here online on Zoom as of right now together, then clearly you want to set up a time to talk with me. Please don't just send me text messages. It's best that we schedule a call. You can always use my calendar link that you've been given, and you can set up a call to go over those questions. If it's just a couple questions, it might be easier for you to email. We will be doing one-on-one training. So if that's something that you want to discuss during a one-on-one, we can certainly do that. You can always book those with me as well. Just let me know. I'm here to help you. All right. Until then, have a great day, and we go from there.